Healthcare is the management of the well-being of animals to ensure normal metabolic and physiological processes in its system. The abnormal or change in the physiological system is often brought about by microorganisms called pathogens. When animals are in any disease condition, the production efficiency becomes low and in some cases may terminate the life of the animal with a consequential economic loss to the farmer. Infectious disease of cattle. Contagious bovine pneumonia or CBPP. CBPP is a disease that infects the lungs of cattle. It is very prevalent in the West African region and other arid and semi-arid zones. Symptoms include rapid and labored breathing associated with cough, anochresia, fever, and dry and hard coat. Treatment of CBPP is very rare and in endemic cases, tylosin may be used. This disease is caused by bacterial infection of Pasteurella multocida. It is noticed by symptoms such as dullness, fever, salivation, and reluctance to walk. Infected animal dies within 2 or 3 days of infection. Animals can be treated with oxytetracycline if quickly discovered. It can also be controlled by yearly vaccination. Actinomycosis or bovine farcy are caused by Mycobacterium carcinogen with observable signs of small lumps or nodules seen under the skin, the shoulders, and the limbs. It is a very difficult disease to treat and separation and quarantine of the infected is advised. Effect on animal is not often very pronounced except for the unsightly skin, but they could come down with tuberculosis. Brucellosis abortus is a disease that affects both men and animals. It has incubation period of few days to months and can infect the uterus and fetal membrane, thereby causing abortion. There is no effective treatment, but the animal could be immunized. Other control measure apart from immunization is to completely destroy the herd where it is detected.
Infectious disease of sheep and goats. So, what are these infectious diseases? First, CCPP or Caprin pneumonia. Disease that can be controlled by immediate separation of infected animals, slaughtering, and vaccination. Some symptoms of this disease are fever and nasal discharge. It can be treated if quickly diagnosed with tylosin. The second disease is foot rot. Disease found both in cattle, sheep, and goats affecting their feet as well as their hooves. Symptoms include inability of the animal to walk. At times, the animal is squat to graze. It can be controlled by use of footbath. Next is ORP or sore mouth, a viral infection of the skin and mucous membrane of the sheep and goats. It is a wart-like cluster of the skin around the feet and mouth. This infection can spread through suckling by the young ones. Standard sanitary procedure should be employed on the farm as a control measure. PPR or Peste des Petites Ruminant. It is a viral infection of goats and sometimes sheep. The animal infected this disease loses appetite and does not eat. Disease is spread through the placenta of the infected animals. There is no known treatment for PPR, but animals that survive always get immune. What are the general diseases? First is bloat. Bloat is a disease that shows with the distension of the rumens as a result of being filled with gas. It can be treated if quickly diagnosed by drenching the animal in vegetable oils or any anti-foaming agent. The second is goat pox, a viral infection with lesion on the skin and internal organ of the animal.
Bloat is a disease that shows with the distension of the rumen as a result of it being filled with gas. It can be treated if quickly diagnosed by drenching the animals in vegetable oils or any anti-foaming agent. Goat pox is a viral infection with lesion on the skin and internal organs of the animal. The most internal parasites are either worms or flukes, which are collectively referred to as helminths. They live in lungs, liver, stomach, and intestine of animals. Roundworms are formed into gastrointestinal tract of cattle and sheep. They mate and lay eggs inside the abomasum of the ruminants, which are expelled along with the dung. Infestation of worm is often accompanied by diarrhea, dehydration, and loss of appetite. The herd should be dewormed about 6 to 8 weeks after they might having starting grazing during the rainy season of repeated 2 weeks after. The adult lay eggs in the air passage of the lungs where they live. The eggs are coughed up into the back of the throat and swallowed. Animals that are grazing easily pick up the larvae and pass them down through the alimentary canal. Lungworms are controlled by the use of appropriate anthelmintics, as may be advised by the veterinarian. Tapeworm or gastoda belong to the phylum Platyhelminths and are related to the flukes. They have segmented bodies that are tape-like and host-specific. The adult tapeworm causes fewer problems, especially in animals under poor plane of nutrition. However, the larvae of the same species travel to the brain or the spinal cord and cause nervous disorder called coinurosis. Benzimidazole can be used for the treatment. Trypanosomiasis is a protozoan infection which affects both man and animals. It caused by the trypanosomes parasites which invade the bloodstream and cause symptoms such as fever, anemia, discharge from the eye, nervous sign, and loss of condition. The vector for this disease is a cheche fly, which is very prevalent in sub-Saharan Africa. Liver fluke is one of the most widely distributed and harmful parasites that affect cattle, sheep, and goat. It causes a disease called schistosomiasis, while in the sheep, the adult fluke lay eggs in the bile duct. The eggs are passed into the intestine and expelled along with the dung on the pasture. Liver fluke is treated with benzimidazole and salicylanalides. Kokoshada is a protozoa disease caused by the emeria of bacteria. The main symptoms is blood-stained diarrhea, where ruminants, especially young ones, are raised intensively. It can be treated by the administration of sulfa drug and antibiotics. Control measure is by preventing animals from eating feed contaminated with feces.
In the last discussion, you learned about internal or endoparasites of importance to ruminant animals. These animals are also infected with external parasites that, if allowed to thrive, may lead to serious economic loss as a result of product devaluation. Most of these affects the skin and consequently the hides of the animal. The secondary effect may also affect the meat value. Ticks are acarines of high importance as skin parasites. Ticks are vectors of some diseases such as anaplasmosis or gall sickness and heart water disease. The heart ticks are oval-shaped, flattened from top to bottom, with a hard protective dorsal surface or scutum, and an anteriorly projecting mouth part. Lice are small, wingless insects that irritate the body of the animals so much that they rub their bodies against solid objects. These are two types of lice, sucking lice and biting or chewing lice. Infested animals get irritated, look pale, anemic, and show persistent hitching or rubbing of their body against solid objects. Lice infestation is treated by deep bath, spraying, or rubbing chemicals like permethrin or melatonin, or by injecting with evomic. Mites belong to the occurrence and cause skin disease called mange. Symptoms of mange include irritation or scratching, biting, rough feeling skin, and loss of hair. Treatment is by spraying, deep bath, injection with ivermectin or evomic, and rubbing of melatonin powder on the skin. Flies are insects that breed during the summer or rainy months of the year. The flies bite the skin and feed on the wound of ruminants. Some of the flies transmit secondary disease. Flies are treated and controlled by spraying, deep baths, use of repellent. This is fungal infection of the skin of ruminants and even man caused by Microsporum or Trichophyton fungi. It is noticed animals first by hair loss in a circular form which may be about 3 to 4 centimeter in a diameter. It can be treated by oral application of griseofulvin.